Hello guys, this is Dr. Dheeraj Masapu. I'm a senior consultant in a corporate hospital in Bangalore. So basically, if you are a general physician and want to enter critical care medicine, this is a video for you. So if you, then some people would be questioning after general medicine, why to enter critical care medicine? Why not go into cardiology, endocrinology, rheumatology, nephrology and all that? So even neurology. The thing is that those are becoming very competitive, okay? Very competitive. So if there is somebody who really wants to have a fixed time shift based work, who wants to stay in a metro, and then who is passionate about dealing critical patients, and then I think it is a right choice actually to go into critical care medicine after general medicine. And if you have a plan to set up your own hospital with an intensive care, then it will be a very beautiful option, because you can set up a hospital and then you can run your ICU, you can admit your patients, and it is going to be a very good career choice. But the thing is, there are certain pros and cons in this decision, because as a general physician or a general medicine guy, you have certain advantages. At the same time, you have certain disadvantages of this particular career move. I'm going to tell you that. So first, let me tell you what are the advantages that you have when you enter critical care medicine. Oh, in this presentation, not only this, apart from that, I'm also going to show you what is the mindset that you require, what are the good colleges, and how many seats are there. I've done research total in DM and DRNB in India, and I'm going to show you all that. Along with that, what are the salaries that you get also. I'm going to explain to you what are the best colleges to join also. I'll explain in this particular video. Okay, let me just tell you what are the pros and cons that a person has when he chooses to enter critical care from general medicine. The main pro that I usually see, and many heads of critical cares in Bangalore are internal medicine guys. So I spoke to many of them, and after that I made this particular video. What they are all saying is that the diagnosis and understanding the disease becomes very easy, because they're already trained in diagnosing conditions during the general medicine time. So that is the main advantage that they get when actually they are going into critical care. The second advantage, what they told me, is that the patient interaction, the counseling part, so they are habituated to that during the general medicine time. So it becomes natural for them. Okay. So for anesthesiologists, what happens is when they enter critical care, so this counseling part wouldn't be there during anesthesia much. So we have to actually pick up that part. But for general physicians, it comes very natural. So the way they deal patients, and they're used to that, so it becomes very easy for them. So these are the main advantages they get when they enter critical care medicine. Okay, but it also comes with certain disadvantages. So disadvantages that an intensivist has is the procedures. So the procedures, like and intensive cares have a lot of procedures like central lines, tracheostomies, intubations, crisis management, and all that. So anesthesiologists actually score high in these particular sectors. But if you are doing a DM or DRNB, 3 years is enough to pick up these skills. And simulation labs are there, you can go and get trained there. So this is the advantage and disadvantage if you come into critical care medicine after general medicine. Okay, and next is the mindset required. So general physicians will have a lot of patients, and general medicine people like to sit with the patient in one room, and they actually like to talk to him, understand, and all that. So this critical care business is totally a different ballgame, where leadership skills are required, and then you need to be calm under pressure, calm under crisis, and analytical skills and all are required. And so these are the different kind of a mindset shifts that a general physician needs to do when he's planning to come into critical care medicine. Okay, so that's the thing. So now you understood, I think, what are the advantages and disadvantages and the mindset shifts that you need to do if you really come into critical care medicine. So then what are the different ways of becoming intensivist? So let me show you the different ways. So DM and DRNB is one way. Before that, I'll tell you the other ways. So EDIC is another way. EDIC is European Diploma in Intensive Care Medicine. So here what happens is you need to have some ICU experience, and then and then there are two parts to the examination, written and oral examination. And then so basically there are so many coaching platforms which are giving training for EDIC preparation. Okay, there is Harish master classes also. he gives training for EDIC. I think many of you must be knowing about that. And then, so EDIC is a proper way you can do EDIC after your MD, and you will be a qualified intensivist. And it is this certificate is highly valuable even if you plan for abroad countries like Middle East, Australia, Canada, and all that. Okay, no, you don't want to do EDIC. Then what is the other way? The other way is doing IDCCM. It is a 1-year course, and Indian Society of Critical Care Medicine would give you this. And 1 year you need to work in a certified centers. You have to go into IDCCM website. I'll keep that link in the description. You can go there and just see. You will actually get into the website and you can do in those centers. And IFCCM is another degree the same society gives. It's a 2-year fellowship. It's more valuable than IDCCM. It's more like IDCCM is a diploma and IFCCM is a proper fellowship course. So here a value will be more. So these are the different ways apart from DM and DRNB. So then DM and DRNB, if you have to do, then what are the colleges? There are 5 good colleges. First, let me show you how many seats are there. So basically there in DM there are around 81 seats in India. So like this is the list. I don't want to read all the colleges names here. So there are around 2-3 seats per college. There are several colleges. I will put this document in the in the link in the description. You can go through all these colleges. And DRNB around 91 seats are there. Okay, there's so many hospitals. So all these hospitals are good. In that 5 I selected if you really want to do, but they're very competitive to get into these hospitals. AIIMS New Delhi is the number 1, and then CMC Vellore, PGI Chandigarh, SGPGI Lucknow, and Amrita. So these are centers. If you really do, these are branded centers. So if you do DM in this center, you will have a brand value also. So otherwise you can do in any center. It also depends upon individual how you're building. Okay. So then between DM and DRNB, some people are multiple times asking, if you plan to go to Middle East, then is DRNB considered? DRNB is considered even if you want to go to Dubai, Abu Dhabi, Australia, everywhere. It is equal to DM nowadays. Okay, so if you really want to go to Middle East and all that, so in the Middle East document it is not written that post DM 5 years is considered as consultant in Middle East in Dubai and Abu Dhabi. Even DRNB also will come under the same category. Okay, because both are equal now. Okay, so only thing what I find difference is DM usually are a little bit of research oriented. That is what I personally see, because I work closely with, in my team there are so many DMs and DRNBs. DMs are research oriented and DRNBs are focused more on the practical and clinical skills since they work in corporate hospitals. So the way I see they interact with patients, the empathy and the soft skills are actually better in DRNBs. Both are equally respected in India, and you don't have to actually worry about what you're doing. But first priority you give to DM, and if you're not getting DM, go for DRNB. So that is my personal and practical suggestion. So then, so we discussed about pros and cons. We discussed about which colleges are better, and then so I will tell you the next thing is there's so many colleges here. Salaries. So the most interesting part is salaries, I know, but see about salaries, so many videos I told you. If you finish your DM with critical care medicine, it depends on which place you're applying. Okay, it can be tier 1 city, tier 2 city, tier 3 cities. Tier 1 city, if you apply, they call you associate consultant. They don't make you a consultant directly. So here what happens is you will be offered a package anywhere between 2 to 2.5 lakhs. Okay, and you will be working as an associate under some consultant. Usually they will be EDIC or some kind of IDCCM and all they were done. Pretty senior guys who work under them. You gain some experience. After 5 to 6 years, you get an opportunity and you go to some other center as a lead consultant there, and then you will be a consultant. Then you become head of a particular unit. They call you a lead consultant and all that. By the time you would reach around 3 to 4 lakhs of salary, and then if you are actually becoming director of intensive care services, then you reach a salary is around 5 to 6 lakhs or 7 to 8 lakhs per month, depending on the revenue that you're generating. I think there's a ceiling there. Above that, I don't think you can cross that level. And if you really think to earn more, you have to go to Middle East or other countries like Australia. Even if you plan to go to UK, Australia, it's very easy to go with critical care medicine than anesthesia. Actually, that is what I am noticing. There's a lot of mails we get, right. So what I'm observing is critical care has a better opportunity than anesthesia if you want to go to abroad. Because a lot of ICUs are there everywhere and everyone wants people to man the ICUs. That's the concept. And then if you plan to settle in tier 2 city, then the thing is like you will be head directly. There is no confusion in that because nobody with DM will be there. You will be paid more than tier 1 cities. So you can directly negotiate for around 3 lakh salary. But the problem with tier 2 cities is they don't give you a team actually. So they don't give you a team. Please note this point, underline this, they don't give you a team. So what happens is you have to take some 1 or 2 MD anesthesia people, or you have to take 1 or 2 MBBS people and run round the clock, take calls 24 hours and you'll burn out. I'm telling you, I really called many of my friends and juniors and then I'm making this video. That is how tier 2 cities are working. Okay, they call themselves big hospitals, but they actually keep only one main guy. They will pay him more money, not even 3, some centers 4-5 lakhs they'll pay, but they don't give you a team. So what happens is, see, it will be good to tell people that I'm earning that much of money and you'll have that kind of a power, but what is the point? Because 24 hours you'll be working. That is the problem with doing DM and critical care and going to tier 2 cities. Okay, anybody has an objection, you can just put comment in the comment section. Tier 3 I don't recommend to go because they don't require DMs. If you're IDCCM and IFCCM guys, go to tier 3. There you first work in an ICU for some time and then directly start your own ICU. There it will work out. Okay, collaborate with a physician and a general surgeon and local pediatrician or somebody, set up your own ICU, invest in that hospital, buy a CT scan and make a small setup. It will work out. In that way you have to plan in tier 3. It all depends upon where you want to select, what kind of life you want. I want a quality of life like a city. I want a very good education for my kids. I want to send them to international schools and all that. If you think that tier 1 is better, then you join an associate consultant. Tier 2 city, my people are there in this particular city and I want to go to tier 2 city, and this is because I am from that place and salary is more. If you think, go to tier 2 city, slog, work hard, and then you'll make money, you can be with your family. Tier 3, if you go, DM and DRMB shouldn't go to tier 3. IDCs and IFCCM guys should go. They have to keep in the mind that they have to make their own setup. With that intention, they have to develop the skills and develop a little bit of local political contacts and then start your own center. So like this, you have to plan your critical care career if you really do after MD general medicine. But with the general medicine, you will click, no doubt in that. And so this is the video, guys. Thank you very much for following the video till now. So many of you are watching the videos but not subscribing to the channel. This is very bad. I think you should subscribe to the channel also. There is a button down. Please click on that. And more such videos would come in the future. Okay. Thank you very much for following the video till now.